I'm Alexis Guild. I'm the Director of Health Policy and Programs at Farmworker Justice. Welcome to our interview series, Revisiting the State of Farmworkers in the COVID-19 Era. This series is aimed to raise awareness about the impact of COVID on farmworker communities and the work being done to support farmworkers and their families. Farmworkers have been disproportionately impacted by COVID, largely due to their poor working and living conditions. According to Purdue University's Food and Agricultural Vulnerability Index, close to 500,000 agricultural workers have been diagnosed with the virus. But that is likely an underestimate of COVID's impact on farmworker communities. Since the start of the pandemic, Farmworker Justice has been working with partners across the country to ensure farmworkers are able to stay healthy while continuing the essential work of feeding our country. We are here today to discuss the impactful work being done by farmworker-serving organizations to respond to the COVID-19 pandemic, empowering farmworkers to achieve workplace protections, access healthcare, and community resources. Today, farmworkers are starting to access the COVID-19 vaccine. However, more work needs to be done to ensure farmworkers are able to get vaccinated, to address their living and working conditions, and improve their access to healthcare. Today, we're joined by Guadalupe Cuesta, the Director for the National Migrant and Seasonal Head Start Collaboration Office. We'll be discussing the work of Migrant and Seasonal Head Start to support and provide childcare and food security and other services to farmworker communities. Thank you so much, Guadalupe, for joining us today.
My pleasure, and thank you for inviting me.
Can you start off by just sharing a little bit about the National Migrant and Seasonal Head Start Collaboration Office and the work that you do?
Sure. The National Migrant and Seasonal Collaboration Office is a nationally based office designed to promote high quality direct service delivery through collaboration, coordination, and alignment of high quality services for all migrant and seasonal Head Start families. We do that through basically working in collaboration with partners such as Farmworker Justice, so that our families are able to access resources both at the national and federal level. And the office plays a really key role for migrant and seasonal Head Start. We represent migrant and seasonal Head Start children and families in key policy and advocacy efforts in the area of school transition, early learning systems, professional development, and all other priorities that are brought down from the Office of Head Start or the regional office, Migrant and Seasonal Head Start.
Can you share a little bit for those who may not be familiar about Migrant and Seasonal Head Start and how that's different from Head Start?
Yes. Well, there's many things that are different. One is that our programs are seasonal, and the seasonal meaning that they open anywhere between 6 weeks through 6 months. And some of our other programs may run up to 9 months of services and they utilize funding from other sources to do wraparound services for our families. The performance standards, we have high, I think one of the best high standards that can be for serving children and families, and we do those in those seasonal programs. Whereas, like, let's say Head Start, regional Head Start, they run traditionally the school year period, so they have a lot more time. So what we do is sort of have prepackaged programs. So we have to do a lot of work before the centers open, a lot of collaborations, and make sure that all those services are ready. So when the families start coming in, the children become enrolled, that we're able to provide those performance standard services. Another thing that I think is a little different is our criteria for enrollment. We Head Start base families' income out of the federal income poverty guidelines, and our migrant heads and Head Start works within that low income federal guidelines, but Migrant Head Start has an additional income guideline, which is at least 50% of their income has to come from agriculture work. So in that's the difference. And so our families usually, when they are in Migrant Head Start, have to be working in order to provide for us to be there. Migrant Head Start cannot do home base where Head Start can do home base. Our families are working, so we only use a model of center base and family childcare for our services. We also, Migrant and Seasonal Head Start provides transportation, whereas Head Start does not. And that's because we depend on bringing the children to the center while parents leave for work, maybe sometimes at 4 o'clock in the morning. So our buses run that early. Our centers open that early. And our centers may open from, the traditional is 8 to 12 hours a day or 10 hours a day, but they may run in the high peak season for 14 hours a day and may go up to 7 days per week. Usually it's just 5 days per week. Whereas Head Start, they provide, I think their full day is 9 hours, 7 to 9 hours. So that's a little bit of a difference.
And I know that Migrant Seasonal Head Start serves, the families in multiple ways, and not just, in the classroom, but also providing resources. The families are really involved, and through parent advisory councils, and there's a lot of connection to the farm worker communities. Can you share how the COVID pandemic has affected the families that Migrant and Seasonal Head Start serves?
Oh my goodness. It has been very devastating and stressful for the parents, children, and for our staff. Our programs closed immediately when the pandemic began. But our families continued to work in the fields. So if our programs are closed, families had no childcare. And working in the fields, they depend on that to have their children in a safe environment. So one of the parents had to stay home, or they had to find alternative childcare, which cost them, some of their salary. So with one income and paying for childcare, that was financially, that was very devastating for the families. The children, we're a early Head Start school readiness program, and the children depend on that socialization with their peers for learning. Their social emotional interactions with the family who is stressed is was not healthy, and let's say, and also they depend on their teachers as primary caregivers. So that's a stability that they had that they didn't have if the centers were closed and families had to stay. And then for our staff, compassion fatigue is high. Our staff not only are going through the pandemic themselves with their families, but also their caregivers. So they worry about the children at the program, and they also worry about, the rest of the family. So depending on the state and everything, some of our programs were open and some of them were not. We still have many programs that are not open. So that's very devastating to our families.
And in those areas where maybe they stayed open or even where they closed, how did the Migrant and Seasonal Head Start sites respond to the needs that they saw in the farm worker communities that they serve?
Let me tell you, the Office of Head Start was very flexible with the funding. So our grantees took advantage of that because they were not open, let's say. They provided the communication with parents was so important. So they provided laptops or computers for the families. And they even had those hotspots for families to connect to the internet. The other thing they did was make sure that children receive their meals. So they went ahead and opened their kitchens. And either the parents drove by to pick up the food, or the staff delivered the food to the parents, because that was very important for them. The other thing that was really, I think, kudos to the grantees, is that they used some of their monies to provide for mental health services, not only for the staff, but also for parents. And parents dealing with the children, it was a direct training for them, information, platicas, and all those kind of things to ensure that our parents had a little bit of relief. So that was.
You mentioned how some of the grantees, I assume many of the grantees, provided meals to the families, even if they were closed. Why is food security such an issue, and why was it important that Migrant Head Start grantees provide those meals to children and their families?
Well, not only did they provide meals, I forgot to mention that they also created pantries, food pantries for the families. You know, farm workers are not paid very well, as you know. So losing some of that income, there's that puts a stress on the family's budget. And also not having that money, and also the stores weren't if you remember correctly, the stores were kind of empty shelves. So we needed to provide some assistance to the family, who the children needed their meals. I mean, that's one of the pluses of being in Head Start, is that children do meet we meet their nutritional needs. I think that I think for farm workers, it's just the low wages that they have living in remote areas. Food access is not um, grocery stores are not accessible. So, you know, that's something that it has always baffled me, that people who work in the fields, who pick the food, that we eat, have that insecurity. They're not able to access that. They cost a lot at the grocery store. And with one income, or sometimes no income, that's hard.
Yeah, it's one of the cruelest ironies, I think, that the farm workers who, have so much pride and dignity in
Yes.
harvesting our fruits and vegetables that keep us healthy are unable to access those fruits and vegetables themselves. And I think oftentimes people are quite surprised when they find out that farm workers are extremely food insecure for all the reasons that you mentioned. And I would imagine the pandemic just exacerbated those issues.
I remember when parents used to just be given food. They could pick the food that they were picking and take some home. Now now they're paying for that. So it's no longer available to them. They have to go to the grocery store to buy it. And that's so ironic. Yeah.
And I also think, you mentioned how because some of the sites had to close, that one of the parents would have to stay home with the child. So that's lost income, which I would imagine makes that food security situation even more difficult, because they have one less income in order to able to afford to buy food.
Yeah. I think the pandemic, it wasn't just like the parents lost all that income, and so many things that they were able to access before the pandemic became even harder for them. you know um, Having to go look for food at food pantries, and that takes some going out and doing, and sometimes language gets in the way. So, and we knew that was was a possibility for parents, so our programs did provide food pantries and the meals, and made sure that there was plenty for them to keep even on the weekends.
And then I know that we also worked with your office to connect them to an anti-sewing squad who was sewing masks and
Oh
continued
my
to sew masks
God.
so that they could provide them to families.
I was so thankful because in the beginning of the pandemic, you know how you're looking for supply, they were looking for supplies, especially masks. And thank you for connecting us to the um, anti-sewing squad. They provided thousands of masks for our children, but also for our staff. So we're very thankful for that. So our centers were kind of secure right there. We were very thrilled.
It's amazing that the staff and the families and the children weren't able to access masks themselves.
Hmm. Alexis, I wanted to share a little bit more about some of the issues that the parents were facing. That we recently had a town hall with the parents, and one of the difficulties for them is um, technology.
Mm.
Um, we had to Migrant Seasonal has our staff help guide parents to connect to them, but parents who have children in the public schools were having such a difficult time. There was a lot of misinformation, and sometimes it wasn't in Spanish. So the information that was flowing to them was sometimes not correct, and it confused the families. That's even so now with the vaccine, more so now. But public schools provided a portal for families to connect to the teachers and connect to for them to see their child's progress. Um, but the portals are all in English. First of all, our families, I think, are new to the technology of laptops and connecting to something like a portal to see. But if it's not in Spanish or there's nobody to help them out, they're not able to help their child through their educational, through their studies or connect with teachers. So that was really something that they brought up and wish that they could have had more assistance with that.
And I know that Migrant Seasonal Head Start spends a lot of time, and you mentioned school readiness, trying to prepare the parents. And it's important to remember that these families don't just have young children, but children of all ages.
Exactly, exactly. So that the type of help, and we were always there trying to help parents, but it's kind of hard to connect parents to connect to the school. And there's a lot you can do via Zoom, but there's a lot you can't. So I think our staff did a lot of advocating and a lot of contacting public schools on behalf of parents for that. So I'm really happy about that. But I think that that's something that really was very devastating to parents, not being able to really help their children. Um, for example, parents not being able to go to work, but they stayed home, but they don't understand what their child's doing on Zoom. Um, and for the little ones, for our age group, um, they can't stay on tablet that long. So it was
Mhm.
very hard to have someone there with the child learning at the same time. So that was also that was a challenge for parents. So I just
Absolutely.
mentioned those things.
Absolutely. No, thank you for mentioning that because that's a huge challenge that I think we continue to encounter and try to engage because technology it's a huge gap. And thank you for all of the work being done by both your office as well as the Migrant Head Start grantees across the country. They provide so much wonderful care and resources and support to our farm worker families. So thank you for all of your work and the work of all the grantees across the country.
Thank you also for being such a great partner and collaborator and always providing services to our families and support. Thank you very much, Alexis.
And thank you for joining us today, Guadalupe. Really appreciate it.
All right.
And thank you to all of you at home for watching our program, Revisiting the State of Farm Workers in the COVID-19 Era. Farmworker Justice is a nonprofit national advocacy organization that works at the federal, state, and local level to empower farm workers to improve their immigration status, living and working conditions, occupational safety, and access to healthcare. Our work is made possible with the help of our generous supporters. Please visit farmworkerjustice.org to become a supporter today and to stay up to date with our COVID activities and other ongoing priorities. You can rewatch this episode and the rest of our series, as well as the interviews from last year's series on the state of farm workers in the COVID-19 era on our website and on our Farmworker Justice YouTube channel. Get connected with us on social media as well by following us on Facebook, Instagram, and LinkedIn at Farmworker Justice, and on Twitter at FarmWRKR Justice. Thank you for joining us.